will reach out to the individual once the report has been submitted, and they're going to try to get them connected with services. And if for any reason at all, if the student needs ongoing support, we're going to follow up with them, whether that's monthly, weekly. Some of them may even need a daily check-in. If you feel that the student is in imminent crisis to self, then making sure that not only are you submitting a report, but you're calling 911 in advance. Making sure that the students have everything that they need and support in the moment that they need it is critical. But if it's a crisis, we want to make sure that the appropriate individuals are responding at an appropriate time. Another thing within care team is that anytime a student is transported from the university, and this is a really touchy subject because we don't like to think of those crises, but they do happen. And one of the things is that once a crisis occurs or a student is transported to a higher level of care, whether that is our community crisis center care, ComCare Community Crisis downtown, or whether that is a hospital. It could be for mental health. It could be they fell and broke their ankle, anytime, and we will be contacting the emergency contact listed in their student account. If you are not listed as the emergency contact on the student account, you're not going to be notified. And so making sure that you have that conversation with your student, and number one, making sure that they have that updated every semester. We know that students move, phone numbers change, all of that information needs to be updated every semester, especially as information changes and needs to be updated and available. The last thing I would say in regards to care team is knowing that it's not punitive. Mental health across the United States is on the rise, particularly for students in college. Not only are we in the midst of a pandemic, and so individuals are isolating, which heightens depression, anxiety. We are doing remote learning for some classes, which also again increases some of these some symptoms. And so it's not uncommon for us to see an increase. And so making sure that we are talking to our students about it's okay to not be okay. It's okay to ask for help. And when you're having conversations with your students, talking with them about, how are you managing your stress? Are you anxious? Do you have any anxiety? What are you doing to combat those things? And if you find that they're struggling with, answers to those, get them connected with us, get them connected with student health, get them connected to counseling and prevention services, wherever they land up, and we will refer them to the appropriate place if need be, if it's not our area. The thing that I absolutely love about Care Team is that we thoroughly believe in creating a community of care where every single individual on our campus, number one, feels supported, they feel seen, and that they know that somebody is on standby, willing to help them with whatever it is that they're going through. And so, again, our web address is wichita.edu/care, and we meet once a week. And so it's nice to know that there's somebody on campus who is looking out for your students. We're not babysitters, we don't babysit, but we thoroughly believe in providing the wraparound services to ensure that our students are successful. So that's not only looking at the academic side of how sometimes life happens and it impacts our academic success, but also personally, and what does that do to us as an individual, and how can we work with our campus partners and community partners to ensure our student success. If at any time you have questions, you can always feel free to email. All of my information is on the wichita.edu/care website. If you've not already done so, we have a weekly or monthly newsletter that goes out to parents at wichita.edu/family. And we have a lot of mental health and just overall health and well-being information that's shared in the newsletter on how to coach and have conversations with your students about life and how to cope and manage. Tia? I can't hear you.
Okay. Oh, technology. Hello, folks. Okay. I'd like to thank Alicia for her words about the CARE team. I'm going to enter in the information in the chat about where to sign up for the Parent and Family newsletter if you haven't already done that. And in the meantime, I'm going to introduce you all to Heather Stafford from Student Health Services, who is going to talk to you about health. All right.
Hi, everybody. Welcome to our session today. My name is Heather Stafford. I'm a registered nurse, and I'm also the Associate Director at Student Health Services. So what is Student Health? We are basically the medical clinic on campus that is here to serve your students. We are located in the Student Wellness Center, which is located in the Steve Clark YMCA on campus. And we are here with the Counseling and Prevention Services team, like Jessica. And we want you to know that, we're here to answer any questions about COVID, any questions you have about your students' health. A lot of questions are very personal. So Tia is including our email on here. So if you have a personal question that you would like to ask one of our staff, you can do that as well. Your students have access to our services. They pay student fees, and so that's why they get really cheap healthcare services here at Student Health Services. We see everything from sore throats to bronchitis to sprained ankles to physical exams. We have lots of professionals here that have served college health students for quite a while. Our medical director, Dr. James Keller, is here 4 days a week, and he has been here for over 40 years. And so we all understand the needs of students. We understand financial barriers. We understand what they need to be successful in classes. And so we do everything we can to help your student out as much as possible. A basic office visit here at Student Health can be from $30 to $35 for just a regular office visit, and that can go up to $40, $45 for a physical exam or a women's well woman exam. There's other costs that they might incur while they're here because we do laboratory services. We draw a lot of blood all day long for various reasons, and we send that to our reference lab at Quest Diagnostics. And then we also do a lot of rapid testing here. So we can do strep testing, pregnancy testing, influenza testing. And we also do currently see symptomatic students for possible COVID-like illnesses, and we do COVID testing here as well for our students. We also have what we call an institutional drug room. And basically what that is our form of a pharmacy. We are with our providers here, because we have mid-level providers like nurse practitioners, and we have different physicians that come in the clinic. We are able to have a pharmacy here. So we have antibiotics, antifungals, creams, ointments, birth control pills, different contraceptions. We have lots of different over-the-counter medications on our website. You can see all of our list of over-the-counter medications. And that way a student, can ask for just like some regular Claritin for their allergies, and they don't have to see a provider. They can just come up and ask for it. Right now, currently, we are having curbside services, so the students don't have to come into the clinic if they don't want to, and that they can just call us and ask for the curbside services at 316-978-4792, and we can bring out medication to them. We can bring out refills of their prescriptions if they need it. And different things that qualify for curbside services. And we've been doing that since COVID started back in March, just so that students have that little peace of mind by not actually having to come into the clinic if they don't have to. Some of the other services that we provide is we do a lot of health education. Our visits are 30 minutes for students, and that is so that we just don't send a student off on their own with new medications and new diagnoses. We sit down with them, we talk to them, how's this going to affect you? How's this going to affect you in your classes? And so that way, it's more of a holistic approach to what they need to attend WSU and be successful. A lot of health education outreach occurs. Currently, we are doing a lot of virtual events. We have a weekly Tuesday talk on Tuesdays at 2 p.m., sometimes on Facebook Live, sometimes it's recorded. You can find that on our YouTube page, but you can also find it on any of our social media platforms, and that is found on our website. But on these Tuesday talks, we talk a lot about different health disease processes. We talk about sleep. We talk about like ear problems, contraception. We talk about what new students needed to know this summer. So if you want to go back and listen to the one that we did for parents and having new students at WSU and what that means to you, that might be one you want to take a listen to. But we're here for the students, and we are trying to do what we can to help keep the campus healthy as a whole. Tia.
Awesome. Thank you, Heather. I'm going to get you back out of the stream for a second. Let's see. All right, so at this time, I'm going to ask some folks some questions. It looks like we didn't get any questions in the chat function, so I'm just going to ask those that were previously sent to us via the registration. So Heather, one of the first questions that was asked was if flu shots are being offered on campus, and if so, how can they obtain them?
So we anticipate getting flu shots sometime in October. We let the campus know as a whole. Those are typically only for students, and they will be $20, but we will also file health insurance plans. So if your student has Blue Cross Blue Shield of Kansas or Aetna, one of those, we will make sure that we file that insurance claim, because most insurances pay 100% towards a flu vaccine. And so that way the student doesn't have to pay out of pocket. We'll try and file that claim for insurance first. And we did purchase a small amount, not knowing what the COVID situation would look like and if students would be on campus, which a majority of the students are in online only classes at this point. So we did not purchase a whole amount. So it will be while supplies last.
All right, thank you, Heather. Let's see, one of my other questions, this is more of a scenario that we received. If my student lives on campus and it appears that the roommate seems down and has not been going to class, what can my student do to support their roommate? And I'm going to direct that to both Alicia and Jessica.
Yeah, and so I think the best thing to do is to try to engage in conversation with the roommate, and in addition, making sure that they let their RA know. A lot of times the RAs have additional information, and this could really help. Again, put that puzzle together of, okay, they're beginning to withdraw or they're beginning to isolate, do some things that may be of more concerning behavior that would warrant either a care report, a referral to CAPS, and that way we would be able to, again, just be able to provide those resources to the student. But that's what I would recommend. Jessica, do you have anything to add?
Yeah, I was going to say similar things, talking with the RAs and the housing staff. They're really great over there, kind of like keeping tabs on how everyone is doing. And then I was also going to refer to care team. Here at CAPS, we also, if you do have like questions or concerns, you can call and just consult with one of our clinicians, and not necessarily, you know, about your mental health or things like that, but questions like that, you can call and consult with one of us. But yes, I would say probably care team and housing are your first options.
Great. All right. So my next question that says, it looks like we had a family member who their student had a grandparent pass away, and they weren't sure about their student being able to travel. So the question that was brought up that says, in the event my child has to travel for a family obligation, what precautions should they take before, during, and after travel? Heather, I'm going to pass that off to you to answer, if that's okay.
That's a really great question. And I think first I would start off with checking the airline. If you're traveling by air, and making sure that you're following whatever guidelines that the airport has put through. whatever mask situation they have, whatever they encourage for travel to that certain destination. There is a site on CDC, so it's cdc.gov/travel. And depending on wherever you're traveling, you can type in where you're traveling to, and it puts in health advisories in there. And you can probably look and see what the COVID situation looks like at that time. But I would always just encourage you to monitor your own health. Make sure you're checking for, a temperature or symptoms that you don't normally would have at this time of year. And that you're also kind of make sure you take hand sanitizer with you, keeping a mask on at all times, trying to avoid large groups of people if you can, trying to stay 6 feet away from others, the general baseline guidelines that are put forth for COVID. And then as of right now, the Kansas Department of Health and Environment does not have any restrictions for in the United States travel. So that's something to maybe look at in the future if things ramp up again when flu season hits. But as of right now, there's no restrictions on travel inside the United States. However, there are some outside the United States. So again, it depends where you're going, and just to kind of make sure you're keeping yourself up to date with the current situation, wherever that may be.
Thank you, Heather. And I would say for folks who might be tuning in and listening to this response, if they have specific questions, isn't it true they can still email you at student.health@wichita.edu?
Exactly.
All right, so I have one last question, and I'm going to pitch that back over to Heather as well. And the question is, if a COVID vaccine becomes available, will that be offered free on campus?
I guess it all depends on the government and the CDC, and what right now they're saying that a COVID vaccine would be free. I do know that it would consist of two shots. So that's something else to look at, but we are hoping that just like everybody else, we would get that vaccine as soon as it is made available, and we would communicate that with the campus community as a whole.
Okay, I want to thank all of our presenters who joined us today, Heather, Alicia, and Jessica. You all did a great job at answering everyone's questions that they provided to us. Again, this is the Holistic Health and Wellness session. We'll be doing this session again at 6 p.m. if you didn't get to catch the whole thing. And make sure you tune in tomorrow, and you'll get to hear from some of our staff from Residence Life and Housing. So if you all have any questions, feel free to send over an email or to go onto the registration page at wichita.edu/family weekend for more information. But thank you again for joining Shocker Family Connections. Bye, everybody.